Afib. What is it? Afib is shorthand for atrial fibrillation. No, not some crazy new dance craze, but a medical term for the pacemaker in the top of your heart going awry. To understand the pathology of Afib, we have to review some of the basics of the heart's electrical conduction system. This is our patient, Mike. Shut up, Mike. This is what Mike's sad little Grinch heart looks like, so we'll improvise with some third graders scribbling. The heart is composed of two upper chambers, the atria, and the two lower chambers, the ventricles. In the right atria, there's two spots of specialized cardiac tissue that produce their own electrical impulses called nodes. There's the sinoatrial, or SA node, and the atrioventricular, or AV node. During a cycle of your heart, your SA node sends out an impulse to both of your atria, which stimulates the muscle to contract. This forces blood in your atria down into your ventricles. The impulse from the SA node then travels down a special pathway to the AV node, where it is amplified and sent down the left and right bundle branches and further into the rest of the ventricular muscle through the Purkinje fibers. This phase stimulates ventricular contraction and injects blood out of the heart. In Afib, instead of the SA node sending out steady impulses at 60 to 100 beats per minute, rogue atrial cells produce their own impulses at irregular and chaotic rates. The myocardium of the atria are receiving insane amounts of electrical messages, like that creepy ex who won't stop texting you. So instead of the atria contracting and ejecting blood properly, like this, they both sort of just quiver, like this. While your atria is spazzing out, your AV node is receiving all of these crazy impulses, but kind of like a bouncer at a nightclub, it does a pretty decent job at only letting a few of the impulses through, even though a couple still sneak in. Because of this, your ventricles still experience a full contraction, but due to the extra impulses, the rate is fast and irregular. So what's the problem? Because your atria are just quivering, blood isn't properly ejected from the chamber and hangs out in the nooks and crannies in the muscle. If this happens long enough, it can trigger the clotting cascade, and that clot can take its happy self to the head and cause an ischemic stroke, travel to the coronary vessels and cause a heart attack, or really anywhere else in the body. So what are the signs and symptoms? We'll show you on this high-budget skit that was accidentally filmed vertically on a cell phone.
How you doing today, sir?
Not so hot. I'm feeling a little weird.
What's going on?
Well, I'm suffering from shortness of breath, fatigue, lightheadedness, and it's kind of hard to describe. It's like this weird fluttery feeling, you know?
Like palpitations?
Feeling like you have a fish flopping around in your chest is one of the biggest distinguishing factors between Afib and you having a heart attack. So the first go-to diagnostic test for any heart condition is an ECG, or electrocardiogram, which measures the electrical activity of the heart, and in a normal reading, the P wave in red displays atrial contraction, the QRS in blue shows the ventricles contracting, and the T wave in pink is repolarization, or basically relaxation of the ventricles. So here's what a normal rhythm looks like. The P and T waves are easily visible and the QRS complexes are evenly spaced apart. I start playing with the ECG to replicate Afib, but on the bottom is an actual rhythm strip of an episode. You can see the P and T waves are masked by scribbles since the ECG is picking up the electrical activity of the atria's rapid and sporadic impulses. You can see the QRS complexes are unevenly spaced apart, and this is because, like we talked about earlier, the ventricles are receiving hundreds of impulses, but only trying to let some of them through, giving the irregular heart rate you see on the rhythm strip and felt by the patient. One of the other methods of confirming Afib is an echocardiogram, which uses sound waves to view the heart. It's the same machine they use in Grey's Anatomy to view Callie Torres and Mark Sloan's love child during pregnancy, but instead of a baby, it views the heart. So now on to the plan for treatment.
So, what can you do for me, Doc?
Well, the first thing we're going to do for you is get you onto some blood thinners. Hopefully stop you from getting a clot. Next thing we can do is possibly send you home with some antiarrhythmics, but that is nowhere as cool as cardioverting you.
What's cardioverting?
Cardioversion is when we either use meds or Zeus amounts of electricity to stop and then restart your heart.
So one of our last options is going to be ablation. Ablation?
Basically stick a catheter into one of your veins, feed it up into the heart, and then we use either cold or electricity to zap away those little pesky hot spots that are causing the Afib.
Alright, sir, so you got any questions?
Yeah,
Let's get started.